Hi again. As you start to transition within your role, we're going to be looking throughout the duration of this program on how you incorporate theory into your practice and how theory is incorporated into research. So, for this particular slideshow and lecture, we're going to talk about how to define theory, what are the different parts of theory. We explain some adapted theory and describe the relationship between the scholarship triad, is what I call it. Theory is a generalizable concept, and it seeks to, describe facts, make an understanding. It seeks to bring a perspective to an idea, and it seeks to explain why things are happening and make connections between a relationship between two things. So, the parts of theory. First, you begin with ideas or predictions. So you have like a hypothesis, which I know that you've heard that word before, more of a scientific research-based word, which is the tie-in of research into theory. But you have an idea of something, and then you make a prediction based on that idea or that hypothesis. Then you seek to define. Maybe you have what's known as a concept analysis. You take a concept of nursing and you study and see what's available on that concept. Or you seek to do research to define what a concept is. You have something that's measurable. Again, just like research, you have the measurability of variables. And it also, you want to describe relationships. Nursing theories. Nurses need to discern theories. A lot of nurses might be afraid of theory. It doesn't make sense. It's overgeneralized, and it's applicable, or it's hard to see the applicability. So nursing adapts theories from other disciplines as well, so social theories. So we're going to go through that just a little bit, and especially in your theory class. Adapted theories include, you have Maslow's hierarchy of needs, where you have the physiological needs. You need the food, shelter, water, excrement, those types of things, and then you kind of move up in the pyramid. Then you need safety, and once you have all of those things and you've developed this behavior of safety, then you can go up to love and belonging, where you're seeking out the interpersonal relationships. Then it builds on your esteem, and then you have self-actualization. So as you climb that pyramid, there are a lot of other adapted theories that you may or may not be aware of. For instance, Erikson's psychosocial personality development, Piaget's cognitive development, and Kohlberg's moral development are also theories that nursing has adapted into practice. General system theory. There is a broad incorporation of theory into practice. I can go to almost any situation and describe how Patricia Benner's novice to expert theory is applicable within nursing practice. So there are instances like the theory of caring, where you can apply that theory to an broad sense of people who you treat. So there is a hierarchical order. You have this wholeness and this exchange of information. So all of this incorporates into that general theory that, again, might seem a little scary. And it seems scary because it's hard to understand. There's some ambiguity to theory that makes it a little challenging. The triad of nursing, you have theory, practice, and research. So you take the theory, you research the theory, you disseminate that knowledge through publication, then you apply that knowledge into nursing practice. So that is the impact of theory on nursing. Implementing theory. First, you want to comprehend your own inner values and beliefs. What do I believe? What makes me who I am? Then you want to identify and define what the key ideas are about implementing this theory. You want to research multiple theories so that you can find an applicable theory. Sometimes you're going to find that one situation with one patient has multiple theories that are applicable. So you'll want to research how I'm going to implement these theories into my personal practice. And you want to distinguish these theories with your personal beliefs. And finally, you're going to want to execute the theory into personal practice, and you want to see how it's being used. Then you want to go back and evaluate its use. Did I use it correctly? Am I seeing the progression? That inner inflection is what you want to come back to. So that is the end of this lecture. The next slide is references. There is a video on what is theory. I felt like it had a good little sense of, like a good little definition. You may not want to watch the whole thing. I recommend watching the first 40 seconds of the video. It doesn't take very long. If you have any questions, feel free to reach out to me.